بتاعته اليوم إن شاء الله هناخد anatomy of the female reproductive system. As an introduction, it consists of two parts عندنا internal genitalia والexternal genitalia. Internal genitalia عندنا two ovaries which are responsible for the ova, and then we have the duct system which is responsible for transportation عندنا uterine tubes والuterus والvagina. وبعدين بالنسبة للexternal genitalia we're going to collectively refer to it as the vulva وحنشوفها في السلايدات اللي جاية. طيب أكثر التركيز حيكون على uterus, which is a hollow, thick-walled and muscular organ because there's a cavity in the middle. It's going to be in the true pelvis وحيكون بين البلادر والrectum. And this is important لما نجي relations. So it's going to function to adapt in size and structure على حسب whatever the embryo and fetus needs. In an adult nulliparous woman, meaning she's never given birth, it's going to be pear-shaped and flattened. Well, it consists of three main parts. عندنا الفندس والbody والcervix. Fundus is going to be the topmost part here, and it's going to be above where the uterine tubes enter. يعني تخيلوها كده جاية. But then the body is going to surround the cavity, while cervix is going to be divided into supravaginal and vaginal parts. هتوضح في الصور اللي جاية. لكن it consists of a cervical canal, and then it has two separations. اللي هي internal os. This is going to be the separation between the cervix and the body. And then we have the external os, which is going to separate the cervix from the vagina. But the parts زي ما قلنا, the fundus is above the entrance of the uterine tubes. It's going to be here. وبعدين the body is going to be below the entrance and triangular in cross section. نيجي للcervix. It's going to be the most narrow part تقريبا هنا. هذه الصورة يمكن تكون أوضح. The endocervix and the ectocervix is the same as the supravaginal part and the vaginal part. فزي ما انتم شايفين هنا, the vaginal part is going to be surrounded by pockets اللي هي الfornices. It's going to surround them anteriorly, posteriorly, and laterally. لكن يعني أوضح شيء laterally كذا باينة. طيب وبعدين the cavity of the cervix is going to communicate with the body through the internal os زي ما قلنا, with the vagina through the external os. وبعدين what we need to know here is that before giving birth, the external os is going to be circular. لكن after it's going to look more like a slit. طيب نرجع للfornices. The fornices are going to be important because they're not only are they relations of the cervix, بس هنا يهمنا إنه we know that the posterior fornix is the deepest, which is why fluid accumulation happens there and is usually the point where insemination occurs. طيب نرجع للrelations. Anteriorly إيش عندنا the bladder. In this case, we have the uterovesical pouch, which is going to be the peritoneum that separates the uterus and the bladder. بعدين posteriorly, the supravaginal cervix is going to be on the posterior surface of the bladder زي ما قلنا هنا تقريبا. بعدين posterior to the uterus عندنا the rectum. So بالتالي it's going to also be related to the recto-uterine pouch اللي هو peritoneum between them, اللي هو it's also known as the pouch of Douglas. وبعدين cervix is going to be زي ما قلنا related to the fornices. فعندنا anteriorly is going to be related to the anterior fornix, posteriorly to posterior fornix, وبعدين we have the lateral fornices as well. طيب laterally إيش عندنا the uterine tubes. وبعدين عندنا the broad ligament. The broad ligament اللي هو هذا this sheet of peritoneum تقريبا كذا, as well as the uterine vessels. وبعدين we also have the ovarian ligament, which from its name connects the ovary to the uterus. وعندنا برضو the round ligaments of the uterus اللي هي هذه, وحنشوف أهميتها بعد شوية. The supravaginal cervix specifically is going to be related to the ureter, وهذا مهم because it's going to pass forward to enter the bladder. وحنرجع نشوف the relation in a few slides. لكن غير كذا the vaginal cervix is related to the lateral fornix of the vagina زي ما قلنا. طيب the axes of the uterus, وهذا يهمنا الدكتورة ذكرته كم مرة. عندنا anteversion والanteflexion. So the uterus is always in an anteverted and anteflexed position. Anteversion means that the whole uterus is going to tilt forward. كله كده على بعضه. It's tilting forward. And a way to remember this, we need to know the angle is occurring between which part and which part. فالanteversion from the V, it's going to be related to the vagina. That's going to be the angle between the vagina اللي هو هذا and the cervix. طبعا الرقم مو مهم, لكن you need to know the angles are happening between what and what. والanteflexion is going to be the angle between the body of the uterus and the cervix, and this is where the body of the uterus bends forward. يمكن هذه الصورة كمان أوضح. طيب the structure of the wall of the uterus عندنا three layers. عندنا endometrium والmyometrium والperimetrium. Endometrium is going to be relevant to the menstrual cycle and the different changes that are happening hormonally. بعدين عندنا المyometrium is going to be the thickest layer وعندنا الperimetrium. طيب an arterial supply is mainly going to be through the uterine artery. The uterine artery is a branch of the anterior part of the internal iliac artery. It's going to branch off وحيعطينا the uterine artery. Once it reaches the lateral wall of the uterus, it's going to ascend until it anastomoses with the ovarian artery. وبعد شوية we're going to see why this is important. لكن keep in mind that the uterus has two main supplies. عندنا uterine artery وعندنا ovarian artery. وطبعا venous drainage is going to be from the same the according veins. وبعدين nerve supply sympathetic is going to be from T12 to L1 parasympathetic from S2 to S4. هذه الصورة نفس الكلام تقريبا إنه the uterine artery is going to ascend and then it's going to anastomose with the ovarian artery. طيب three main things that support the uterus are going to be the pelvic floor muscles اللي هي pelvic diaphragm وعندنا the ligaments of the uterus وعندنا the perineal body. pelvic floor muscles عارفينها. ligaments of the uterus عندنا transverse cervical ligaments سهلين من أساميها. The transverse cervical ligament أحيانا ممكن ينقال عنها the cardinal ligament is going to attach the cervix and the vagina to the lateral pelvic wall. عندنا sacrocervical ligament برضو من اسمها it's going to be to the sacrum. بعدين pubocervical ligament هنا it's going to be the cervix all the way to the posterior surface of the pubis اللي هو هنا تقريبا. perineal body زي ما احنا عارفين it's going to be a mass of fibrous tissue هنا. It's going to be between the lower end of the vagina and the anal canal. And it's going to be important because it attaches many different muscles. وهذه لازم نكون حافظينها. فهنا there's like a mnemonic اللي هو blessed life. It has this bulbospongiosis and levator ani, specifically the sphincter of the vagina and the superficial urethral sphincter, and then the superficial and deep transverse perineal muscles, as well as the longitudinal muscles of the anal canal and the external anal sphincter. هذه لازم تتحفظ لأنه حتى الدكتورة أماني ذكرتها in another lecture. طيب بالنسبة ل other ligaments زي ما ذكرنا the round ligament اللي هي هذه is going to be important because it maintains the position of the uterus. فهذه حتثبت اليوترس within the pelvic cavity و it runs through the inguinal canal. فهنا عندنا the round ligament. All of this is the round ligament. It's going to go through the inguinal canal وبعدين it's going to attach to the labia majora. طيب البرود ligament اللي هو كل هذا is going to be a twofold of peritoneum. من فوق they're going to be attached لكن من تحت the two layers are going to separate to allow passage of the vessels. طيب هنا it's just saying that in a child the uterus is going to remain relatively small until hormonal changes occur. The same thing is going to happen after menopause. Since we don't have as much estrogen and progesterone, it's going to become smaller and less vascular and eventually atrophy. In pregnancy, it's طبعا the uterus is going to enlarge بسبب الhypertrophy. يعني there's not usually hyperplasia. The main reason is going to be hypertrophy of the muscle itself. It's basically saying إنه by the third month it can leave the pelvic cavity وبعدين by the 9th month it can reach the xiphoid process. بالنسبة clinical applications and a bimanual pelvic examination of the uterus, which is where you use both hands to examine the uterus. بعدين عندنا anatomy of the C-section, prolapse of the uterus. When there isn't enough support of the uterus ممكن إنه it becomes prolapsed. It's مثلا if we have a defect in the ligaments in the perineal body or even in the levator ani muscles. وبعدين عندنا hysterectomy and how it can damage the ureter because زي ما قلنا the ureter is closely related to the uterus. وبرضو عندنا sonography of the female pelvis. طيب نجي للكيس وهذا مهم لأنه حيكون مراجعة لكل الكلام اللي أخذناه قبل. Basically عندنا صليل she is 28 gravida 1 para 1 meaning she had one pregnancy and she has one child. الزبدة she got pregnant or she went into labor or she delivered a healthy baby boy. طيب during the second stage of labor طولت because she didn't have enough uterine contractions. فإيش اللي صار معاها؟ She delivered the placenta. صار معاها vaginal bleeding and a bug uterus. طيب وبعدين to stop the bleeding they did a laparotomy و bilateral ligation of the artery. حنشوف why they did all of that. طيب it says discuss the parts of the uterus. أخذنا الفندس والbody والcervix والlayers endometrium myometrium perimetrium. قلنا الnormal position is important. الanteversion والantiflexion. The changes during pregnancy حيصير عندنا myometrial hypertrophy و during the 9th month the fundus raises to the xiphoid process. But why does myometrial failure cause uterine atony اللي هو failure to contract, and why does this cause postpartum hemorrhage? عادة after delivery, even after you deliver the baby راح يصير contractions they continue. ليش? Because this causes physiological ligation of the uterine arteries, so it's going to ligate the arteries to prevent any hemorrhage or bleeding. But in this case, we don't have enough contractions, so the vessels are going to stay open and they're going to cause continuous bleeding. This is just a repetition. It's just saying that failure of the uterus to contract is what causes bug uterus. Well, the myometrium isn't responding to oxytocin, so there isn't contractions. But قلنا main arterial supply is the uterine artery. It's going to originate from the anterior division of the internal iliac artery وحيكون within the broad ligament اللي هو البريتونيوم اللي ذكرناه أول. The important relation is it's going to cross superiorly to the ureter وهذا مهم. The uterine artery is going to be above the ureter. There's like a mnemonic, you go to water under the bridge. The ureters, which is under and they carry water, is going to be under the ovarian or the testicular artery in men. But بالنسبة to clinical integration, why does the uterine artery ligation control hemorrhage? It's the most abundant supply to the uterus. So when we ligate it, we can prevent hemorrhage. بس بنفس الوقت there's collateral supply from the ovarian artery, so we can still preserve her fertility. And at the same time, the uterus is being properly supplied. بالنسبة للrelations زي ما قلنا, the body is going to be related anteriorly to the bladder and then a rectum or the rectouterine pouch posteriorly. وبرضو lateral relation عندنا the ureter بالنسبة للsupravaginal cervix. الvaginal cervix قلنا الfornices مهمة. وبعدين why is the ureter at a major risk? زي ما قلنا, because of the important relation, it's very closely related to the uterine artery. طيب the anatomical support of the uterus زي ما ذكرنا أول, the three things. عندنا pelvic diaphragm, which is 1, عندنا ligaments, which are 2, وبعدين عندنا 3 is going to be the perineal body. The role of myometrial contraction in the second stage of labor ذكرناها, لكن it's going to be important for ligation of the arteries. وبعدين uterine contraction نفس الشيء, it's going to ligate the arteries. وبعدين the relationship between pelvic support and uterine stability is going to prevent things like uterine prolapse. طيب نجي للuterine tubes or the fallopian tubes, برضو some people call it the oviducts. المهم, it's a 10 centimeter long tube and it's going to attach in the free margin of the broad ligament اللي هو هذا the peritoneum. طيب it has 4 main parts. عندنا الintramural part والisthmus والampulla والinfundibula. اللي يهمنا هنا الampulla because this is the main site of fertilization. It's going to be lined with columnar ciliated epithelium. ليش? To move the ovum through to the uterus. طبعا هنا we also have fimbriae. ليش? The ovary doesn't directly attach to the uterus. So when an egg is released, لازم في طريقة إنه ندخله inside the uterus. So once, let's say the egg is released, these little attachments اللي هي fimbriae, they're going to try to grab it and push it through. طيب أحياناً the embryo isn't going to implant into the uterus. It might implant into the actual fallopian tube هنا. This is what's called an ectopic pregnancy. وزي ما قلنا, it's most likely going to happen in the ampulla because that's where fertilization usually happens. وبعدين عندنا another application in tubal adhesions. This is when there's intrauterine adhesions or scar tissue اللي هو Asherman syndrome. بعدين tubal ligation, this used to be a form of contraception. نجي للأوفري, ما ركزت كثير على الدكتورة, لكن the main functions is going to produce the gametes, estrogen and progesterone, and it is ovoid in size. وطبعا it's attached to the uterus through the ovarian ligament. هنا we have a clinical application اللي هو ovarian cyst or PCOD. Since it's both a gamete producing organ and an endocrine gland وهذا ركزت عليه الدكتورة, there's hormonal imbalances. Clinically we have يعني 3 criteria. If a patient has 2 or more of them, then يعني we'd consider them to have PCOD اللي هو irregular menstruation, amenorrhea, hirsutism. وطبعا an outcome of this is infertility. But what happens is that there's multiple cysts, so there's failure of ovulation, وعشان كده حتظهر معانا all these different symptoms. طيب clinical case عندنا فاطمة, she has irregular menstruation and excessive facial hair. That's already 2 criteria اللي ذكرناها هنا, and she is moderately obese. طيب هنا wants us to review the anatomy of the ovary. زي ما قلنا, it's going to be ovoid in shape, and it's going to be in an adult, it's going to be in the ovarian fossa on the lateral wall of the pelvis. لكن in a newborn, it's going to be above the pelvic brim. طيب عندنا attachment, it's going to be attached through the ovarian ligament and the broad ligament زي ما انتم شايفين هنا. The function زي ما قلنا oogenesis as well as hormone production. طيب نجي ل a few questions. How does ovarian dysfunction affect menstruation and fertility? It's going to disrupt the ability to release ova and produce hormones. كل هذه الأشياء they lead to hormonal imbalances. بعدين it can present with pelvic pain because there's irritation of the surrounding tissue and nerves due to the cysts because they are enlarged. وبعدين it can be palpable in some conditions زي ما قلنا because we can have cysts or specific pathologies. The role of estrogen in endometrial growth is going to be responsible for the proliferation phase. وبعدين for secondary sexual characteristics is going to be responsible for مثلا development of the breasts. And role of progesterone is going to be responsible for starting the secretory phase and also maintaining pregnancy. Like, why did irregular ovulation lead to amenorrhea and fertility?
Case of amenorrhea. In the case of amenorrhea, we have no corpus luteum, so there's no progesterone. There's irregular or absent shedding because estrogen is unopposed. In infertility, we don't have ovulation and there's no oocyte release أساسا. وبعدين بالنسبة لي the irregular menstruation, زي ما قلنا, the ovaries are dysfunctional, so there's less ovulation and progesterone. The estrogen becomes unopposed, and so menstruation becomes very irregular because it is tightly regulated by estrogen and progesterone together. بالنسبة لي hirsutism عندنا there's an increase in androgens, وبعدين when we have no ovulation, this will cause infertility. نجي للvagina. It's going to be the female coupling organ. It's going to be تقريبا من هنا, and it's a muscular tube that extends upward and backward from the vulva to the uterus. وبعدين at its upper end, the anterior wall is pierced by the cervix. زي ما قلنا, the cervix has a vaginal part, and the lower part is going to lie within the perineum. فهنا أهم شيء نعرفه زي ما ذكرنا قبل, the posterior fornix is the deepest and it's usually the site of insemination. يمكن هذه صور أوضح برضو. طيب clinical applications عندنا examination, عندنا برضو prolapse of the vagina. فأحيانا we can have cystocele or cystocele when the bladder is responsible for prolapse. وبعدين عندنا الrectocele, and this is what happens when the top of the vagina will collapse, وعادة يكون after some type of procedure like a hysterectomy. برضو عندنا vaginal trauma. طيب نجي للexternal genitalia, which we said we're going to refer to collectively as the vulva. عندنا it's going to be formed of the clitoris اللي هو هنا, labia majora is going to be these 2 parts. Labia minora is going to be these 2 parts. الفورشت is يعني a mucosal fold تقريبا at the bottom تقريبا هنا. بعدين الbartholin glands are going to be at the lower third within the vagina, the vaginal cavity. بعدين الvestibule عندنا urethral orifice, وبعدين we also have the vaginal orifice, so we have 2 openings. طيب بالنسبة لي the clitoris and how it differs from the penis, ذكرت الدكتورة إنه the bulb itself in men it's only 1 part, and in the clitoris it's 2 parts اللي هي these 2 parts in green. طيب زي ما قلنا فوق, we have the Bartholin's glands. and so their correspondence in males is going to be the cowpers or the bulbourethral glands, or they're going to be زي ما قلنا in the posterior third of the labia majora, and the duct are going to open into the vestibule اللي هي the part between the two labial folds. If we have مثلا a blocked gland اللي هي ال Bartholin's gland, this can cause a cyst. So this is an important clinical application. بالنسبة لي the vaginal orifice, there is a mucosal fold اللي هو the hymen. Some people are born with it, some people are born without it. المهم تجي على أشكال كثيرة يعني. في الانnular hymen, والأهم شيء clinically اللي هو الimperforate hymen. فهنا the mucosal fold completely covers the opening, فيصير في مشاكل في menstruation, so usually there's some type of surgical intervention. وبس كذا انتهينا الدرس.